We can't continue to do it as we're doing it today. Why? Because the way we do it today, 5 out of every $6 does not come from our own pocket, spent in healthcare. 5 out of 6. 5 out of $6 comes from Medicare, Medicaid, third-party payer, an insurance company, an employer, anybody but me. If it's free, there's no tempering of demand. Come in. So the only way you can temper it is on the supply side, and that is long queues. Have to wait a half a year for hip replacement, half a year for a knee replacement, have to wait a half a year for some kidney dialysis, come into the emergency room and have to wait 7, 10, 15 hours. Ask Canada, ask the UK, ask New Zealand. Now, friends, I've got to tell you something. Single-payer, nationalized healthcare works just fine when your demographics is young. As in Canada, it's been over the years, and in the UK over the past. When your young demographics, it's easy. Inoculations, flu shots, blah, blah, and man, you're on your way to having health care solved for youngsters. So when you're young. But when you get 55 and older, your pharmaceuticals goes like this, and your needs. I mean, kidney dialysis, heart replacements, more CAT scans, MRIs, blah, 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 high-cost medicine. The last time Mandy and I were in London, the London Times had a report card on all London hospitals. Out of 300 London hospitals, a few got a D, almost all got D minuses, and most got Fs. Most hospitals in London, hey, if you're going to come into the hospital, bring your own pillow and bring your own Tylenol. Excuse me. So what's her point there? These national healthcare countries are all saying, this ain't working. See, we got to move to a world where benefits, deductibles, and co-payments are as individualized as your thumbprint. Obviously, every family should have a tax rebate, say a tax rebate of $5,000, so that they can begin to do what? Provide for their own health care. How do you do that? They buy a catastrophic umbrella, and then they buy everything out of a medical savings account that if you don't use it, it's just gathering a non-tax and grows and grows and grows. But even if you do use it, you get $4,000, $5,000, $6,000 a year in your medical savings account, health savings account. You buy the catastrophic umbrella. Why? To protect you from cancer and heart attacks and high-end tax things, of course, high-end medical things. Of course, you want to be protected. And as we go to health savings accounts and people are spending their own money, oh my gosh, oh my goodness, watch what's going to happen. You ain't seen nothing yet. We've had entrepreneurship in computers. We've had entrepreneurship in Federal Express from Fred Smith. We've had entrepreneurship in software, Bill Gates and Microsoft. We've had no entrepreneurship in healthcare. Why? Someone else paid for it. Healthcare in America is like going to a buffet and ordering anything you want, and you're totally oblivious to price. We do not have a health insurance crisis. We have a health cost crisis. And we have a cost crisis because we have no competition in the industry. Once we begin moving competition in the industry, you're going to see lights out, lights out. These national healthcare countries all through the world, what are they doing? They're moving to the market. What are they doing? They're trying to move to a consumer-driven healthcare. What are they doing? Trying to move to America's system. That's what they're doing. What are we going to do? We're going to try Canadian and try the UK, thinking that maybe there's where the answer might lie. But understand, in that system, no normal market, and with no normal market, you don't drive costs down.